Hi, this is my IV push medication administration. I am going to start by verifying my patient's name and order medications order. My patient is Renee Adams with birthday May 25th, 1978. Patient has no known allergies. The doctor ordered furosemide 20 milligrams via intravenous push to be administered over 2 minutes with 3 ml flushes of normal saline before and after. The medication is ordered for now. I am going to go ahead then and grab my supplies. I have my hand sanitizer. I have alcohol swabs, my syringe, my medication, my needle to withdraw my medication, and my two flushes. So I'm gonna start by cleaning up my hands. We're gonna check my medication. So I have furosemide, 10 milligrams per ml. The medication is not expired May 25th. Furosemide, 20 milligrams via intravenous to be administered over 2 minutes with 3 ml flushes before and after administration. So I have the correct medication. I am going to start by wiping up my vial. I'm gonna air dry it. I am going to take out my syringe, my needle. I am going to be giving 2 mLs because it's 10 milligrams per ml. So the doctor ordered 20 milligrams. So it's gonna be a total of 2 mLs. I'm gonna put 2 mLs of air. I'm gonna invert my vial. There is no air bubble. I am going to recap my syringe just for purpose. And I am going to level my medication. Furosemide and 20 milligrams and 2 mLs. Okay. Okay. I have my medicine. Now I am going to prep my flushes. I'm gonna open up my flush. I'm gonna waste because I only need 3 mLs. I'm gonna make sure there is no bubbles. I have 3 mLs. I'm gonna recap this. I'm going to prepare the other. I'm gonna wait. Make sure there is no bubbles. I have 3 mLs. I'm gonna recap this. Once again, I am going to do my second check on my medication. I have furosemide 20 milligrams and 2 mLs. The doctor ordered for Renee Adams May 25th, 1978 with no known allergies. He ordered furosemide 20 milligrams via intravenous IV push to administer over 2 minutes with 3 ml flushes before and after the medication administration. I have the correct medication. Now that I have that, I am going to go ahead and go to my bedside table, to identify my patient. I am going to provide privacy. My name is Michelle. I will be your nurse today. So I am going to clean up my hands and I am going to identify you. Can you please verify your name and date of birth? Patient Renee Adams, May 25th, 1978. Renee Adams, May 25th, 1978. Do you have any allergies? Patient stated he doesn't have any allergies. Mr. Renee, I have your Lasix. I am going to be giving you furosemide 20 milligrams through your IV. Is that okay? Patient stated it is okay. I'm going to clean up my hands one more time. I'm going to put a gloves. And I am going to assess the IV access first to make sure it's not infiltrated. There is no signs of redness. There is no swelling. Patient, if the patient is not complaining of any pain, do you have any pain, Mr. Rene? Patient doesn't have any pain. So now I am going to grab an alcohol swab. I am going to remove the clamp, open it up, and I am going to clean up for 15 seconds rigorously. Okay, and now I am going to flush. This is my first flush. I am going to withdraw first. I'm gonna pull back just to make sure the IV is patent. I pull back, the IV is patent, and now I am going to flush my line. While I'm flushing, I'm gonna make sure patient is not complaining of any pain. Patient is not complaining of any pain and is flushing fine. Now I am going to be giving the medication. So it's gonna be 1 milligram per minute. So I have furosemide 20 milligrams and 2 mLs. Furosemide 20 milligrams via intravenous push to be administered over 2 minutes with 3 ml flushes before and after medication administration. This is for Renee Adams, May 25th, 1978. Patient have no known allergies. This is Renee Adams, May 25th, 1978. So I am going to start by cleaning up my medication, by cleaning up the IV axis again for 15 seconds. I am going to connect the medicine and I am going to start flushing it, and I am going to go 1 ml per minute. Starting now. One ml is in, so I am going to do the second ml. Okay, the 2 mLs of furosemide are in. I am going to toss this in my sharp container. And now I am going to wipe again for 15 seconds. And I am going to do my second flush. I am not going to aspirate, but I am going to go slow because there's still medication on the line. 3 mLs of normal saline. I'm going to go slow. Okay, now it's done. I am going to reassess again. Medication went in, there is no redness, no swelling. Patient is not complaining of any pain. I am going to remove my gloves. I'm going to clean up my hands, and I am going to document. Thank you for watching.